Good morning, everyone. Thank you for coming. I am Patrick Clancy. I am the President and CEO of Philadelphia Works. We are the city's workforce development board. Today, we are excited to have a critical partner come talk to us about impending cuts that will impact a significant number of our city residents, those that are collecting a SNAP benefit. Dr. Val Akush is the Secretary of Human Services for the state of Pennsylvania, and she is joining us today to talk more about those cuts and how we will begin to work along with DHS to build out programs and services to help individuals understand what the requirements are, but also realize that they're not alone in this process, that we will work with them collectively and try to find a way to mitigate some of the challenges that they may have going forward. So without any further ado, welcome, Secretary.
Thank you. Well, good morning, everybody. Thank you so much for having me here. Thank you for that amazing tour upstairs. It's really a wonderful, wonderful facility. You're very, very fortunate to have all of this space and resources, and you can really feel the warm spirit upstairs. There's a lot of very committed folks up there. So kudos to all of you. And thank you for hosting us. And Rep. Waxman, it's great to be here with you as well. It's nice to get out of Harrisburg and be together in Philadelphia. So as you heard from Patrick, we're here to talk with everyone today about some existing and upcoming changes to our SNAP system in particular, and new requirements for community engagement and work reporting requirements. So we'll go through some of that today. SNAP is our country's most important anti-hunger program. It helps 2 million Pennsylvanians, 2 million, feed themselves and their families every day, and directly invests in the grocers, the food producers, our Pennsylvania farmers, small business owners, and the workforce that make and sell food across our Commonwealth. The Republican budget bill, which President Trump signed into law in July, makes several changes to SNAP and creates additional requirements for certain people who receive SNAP. There's a real risk that these stricter administrative requirements will cause people to lose access to their benefits, not because they're not eligible for those benefits. And I want to be really clear about that. That doesn't mean that they're not eligible, but because they have to navigate a whole bunch of new red tape. In Philadelphia County alone, the Pennsylvania Department of Human Services estimates that more than 45,000 Philadelphians could lose access to SNAP because of these changes that have been approved by congressional Republicans. The Pennsylvania Department of Human Services administers SNAP in Pennsylvania, and we're working hard right now to simplify systems to help the Pennsylvanians we serve understand and prepare for these changes. We can't stop these changes. These changes are in federal law, so we can't stop them. But our goal is to help people through the transition as much as we can. So let's talk about what's happening in SNAP. Changes to SNAP are already underway and are happening in 2 phases this fall. First, Pennsylvania had waivers for certain work reporting requirements that most of which began during COVID and were still in place. But due to the federal budget bill, these waivers expired on September the 1st. Because of this, SNAP recipients who are between 18 and 54 without a dependent child under 18 who are physically and mentally able to work must either work, volunteer, or be enrolled in school or job training for at least 20 hours a week or in total 80 hours a month. And those same individuals must report that they are doing these activities to the Pennsylvania Department of Human Services. If SNAP recipients aren't meeting this requirement or aren't reporting or able to report it to the Department of Human Services, they're subject to a time limit on their SNAP benefits. They are only eligible for 3 months of SNAP benefits within a fixed 3-year period. So for example, if somebody needs to start reporting hours that they work as of September the 1st, and they don't report in September, October, or November, on December 1st, they will no longer be able to receive SNAP benefits. Now, that was phase one. Phase two, also a result of these new changes from this congressional budget bill, will go into effect on or about November 1st, and those new requirements expand the number of people who will be required to report work, school, or volunteering efforts. We're waiting federal guidance on the exact start date, but we're anticipating it will be November 1st, and at that point, Pennsylvanians who are between 18 and 64, so today it tops out at 54. November 1st, it's going to go to 64, who do not have a child under 14 years old. Today it's under 18 years old, and who are physically, mentally able to work will need to meet that 80-hour a month reporting of work, volunteer, or education and training. And by the way, people can put those together. They can add those up. It doesn't have to be in one single category. But I'm not done yet. In addition, under OBA, that bill, current exemptions for veterans, homeless individuals, and current or former foster youth between the ages of 18 and 24 will also end on November the 1st. Now, I do want you to know that my team is working on some possible flexibilities around an exemption for unhoused people. It will be an enormously challenging undertaking for someone who is currently unhoused to try to meet that type of reporting requirement. So these are big changes that risk cutting people off from life-sustaining food, and not to put too fine a point on it, but that healthy access to healthy food is what enables people to be healthy enough to go to school and learn, or to get to work, or to volunteer in the first place. We know that any changes like this are very difficult to navigate. And sadly, in states that have already tried to put similar types of work reporting requirements in place, people who are actually meeting the requirements but get hung up in the reporting process can lose access to SNAP. Again, what I said earlier, this is people who are eligible for SNAP are likely, in a number of cases, to lose access to these benefits that they are eligible for. So my team at the Pennsylvania Department of Human Services is working with partners like our state senators, our state representatives, community organizations like Philadelphia Works. We're doing everything that we can to ensure that people maintain their access to SNAP. Last month, we started sending out surveys to SNAP recipients who we could expect to be impacted by these new reporting requirements. These surveys are not an eligibility determination, but they help us figure out if a person meets any of the exemptions that currently exist, and then we ask for information about what we can do to help reduce barriers to meeting these requirements. So if you're somebody that got one of these surveys, please fill it out. If you haven't sent it back already, fill it out and send it back. We will definitely be using the information that you share with us. We've also launched a website to help people understand these changes and go through some of the specifics that I just mentioned. So they can also use that website to get connected to opportunities like CareerLink and other places that can help people get connected to employment and training. The website is at dhs.pa.gov/work. dhs.pa.gov/work. And you can go there and learn in a lot more detail about these changes to SNAP. I also encourage people who are listening to think about ways that you can help your community navigate during this time. For instance, if you have a program that can offer volunteer hours, that could make all the difference in the world to help prevent somebody from losing their SNAP benefits. I was on a tele-town hall recently with one of our state senators, and one of his constituents called in and she shared her personal story, which is that she is working 15 hours a week currently. Her job does not have the ability to offer her more hours, and she also takes care of a sick relative, so she doesn't have a lot of free time. And she said, am I going to lose my SNAP? And heartbreakingly, the answer was yes. Right now, under the current paradigm, you will. So you think about somebody like that. If she could manage to pick up 5 hours a week of volunteer time, that could make all the difference to her in whether or not she loses her SNAP benefits. So these are the types of things we're asking people to think outside of the box about. Are there structured opportunities that you could help create in your community, at a church, at a food pantry, at, any kind of like after school program, anything that somebody could volunteer and just pick up a few more hours a week might make all the difference in the world to them. My team is also working to make updates available on PA Navigate. That is our statewide closed-loop referral system where people can go online and search by zip code for all kinds of services and supports near them. That URL is pa-navigate.org. pa-navigate.org, and hopefully very soon we'll have a button for volunteer opportunities on that website, again, just to make it easier for people to connect with opportunities. So unfortunately, there's very little lead time to get the word out about these SNAP changes, so we really need your help sharing these resources and sharing this information across all of your networks. And one of the things that when you're talking to the people you can do to help individuals and to help the Pennsylvania Department of Human Services is to remind people to update their mailing address with us and all of their contact information. We do send emails, we text people, but there are certain things that must be mailed. It's federal rules. And so we need the most accurate mailing address. And here's the really critical thing. We are also required by federal rules to run addresses through an address check with the United States Post Office every time we send something out. And so if an individual has updated their address with us, but they haven't done that second step, which is update their address with the United States Post Office, it is possible that their address will get changed back to their old address when we put it through this check system, which we are required by federal rules to do. So the message to folks is not only to update your address with Pennsylvania Department of Human Services, but update your address with the United States Post Office. People need to do both. So particularly if any of you are working with individuals and have clients, to make sure they do both. And then I do want to briefly touch on Medicaid. Now, the changes to Medicaid are about 1.5 years away. They will not start until January of 2027. January of 2027. But we are alerting people that this change is coming because the Medicaid program, which is 60 years old this year, has never had any kind of a community engagement requirement. So this will be the first time ever in the Medicaid program. The requirements are identical to the requirements in SNAP. So starting in January of 2027, if you are in our Medicaid program through Medicaid expansion, and that was something that started here in Pennsylvania in 2015, it raised the threshold income that you could have in order to be eligible to get your health care through Medicaid. That is the population who will be impacted by these new requirements. We currently have 750,000 Pennsylvanians who are in that Medicaid expansion population. So those 750,000 people will be required to meet these new community engagement, school, work, training, or education, unless they have an exemption. So very similar to the SNAP once it's up and running. The other thing that 750,000 people are going to have to do is redetermine or re-verify their eligibility for Medicaid every 6 months. Currently, it's once a year. So just imagine what that means. It's, almost 1 million people who are going to have to twice a year go through this process. It is a huge administrative burden on my team that does those eligibility determinations and on the people who have to resubmit all these things every 6 months. There's just really no basis for it other than to try to separate people who are eligible for benefits from their benefits because of this incredible set of barriers and red tape that is being thrown up to get between them and their benefits. So we're encouraging people to just increase awareness. Again, that part doesn't start till January of 2027, but we want to start to raise awareness about it and let people know it's coming, and to start to think about what, they've got a little more time in Medicaid to start to make plans. Could they pick up some job training in this next year? Could they get more engaged in volunteer opportunities in their community? Right, they've got a little bit more time in the Medicaid program, but it's coming. It's here today for SNAP, and it's coming for Medicaid. So again, just thank you all so much for the opportunity to share this information with you. We're so grateful for your partnership in this work, and it's going to be all hands on deck from here out for the next couple years unless there are changes in this federal law. And we are so grateful for your partnership every single day in helping us reach all the Pennsylvanians that could be impacted by this. So with that, I'm very happy to introduce my colleague in Harrisburg, Representative Ben Waxman.
Thank you, Secretary. It's good to be with you here in the 182nd instead of in Harrisburg. And I'm just so appreciative of your department's, aggressive getting out in front of this issue, and the administration and the governor making this such an important top priority to talk about one of many things that is going wrong in our country. So it's good to be here at an important partner of ours with Philadelphia Works. We send anybody who needs a job, who comes, my chief of staff, Aaron Davis, tells me that anybody who comes to our district office door who says, hey, I need to find a job, I'm looking for work, this is the first place that we send them. And so just really grateful for your work and the challenging time ahead for everybody who works around these issues. The first thing I just want to say is that everyone should have access to healthy, affordable food. Everybody. And we are at a time where we are seeing the price of food go through the roof for everybody, and the costs going up. And rather than address that, we instead are now cutting services to the most vulnerable populations in our society around an issue, quite frankly, that is impacting more and more people at the grocery store. And instead of addressing that, we're going to make the situation worse. I think that it's important today to mark not only what is happening, but why it is happening. And the reason that this is happening is very simple. We have people in my district. I represent Center City, Philadelphia. We have a large population of unhoused people, really, that come from all over the region to be downtown and to be in Center City. And we are taking SNAP benefits away from those individuals. We are revoking those benefits so that we can cut taxes for people who live in penthouses, at the top of the skyscrapers in my district. That is what we are doing here. That is what the motivation for these cuts is. That's why we're doing it. It is so that we can pay for tax cuts for the wealthiest people in our society. And that's wrong. And we should continue to fight, and we should get the word out about what is happening, but we should not lose sight of why. And so again, I just want to say thank you so much to the Shapiro administration for leading from the front on this issue, for DHS for taking this time to make sure that people understand what is coming and what is happening. I think it was laid out very clearly. We have a set of rules and regulations that are coming for our SNAP system that are just simply designed to make it harder for people to enroll, to make it harder for people to get the benefits that they need. And that is being done for a very, very specific reason. So we like I said, this, like the Secretary said, this is now federal law. There are limits to what we can do at the state level, but I'm glad to be a partner and with this administration to push back on what is happening and to provide the support that our communities need in this very, very difficult time. So with that, I'll just turn it back over to the Secretary. Thank you so much.
Thank you, Representative, and I think either of us would be happy to field any questions. Anybody has it? Okay. Patrick.
Secretary, can any of this work be done electronically, or do people have to go into the county assistant's office?
Yeah, great question. Thank you, Patrick. So much of this can be done electronically through the Compass app. And we will be rolling out some new digital tools in the next 1 to 2 weeks that will increase the ability of people to do more things through the Compass app. We now have for individuals who have access to a laptop or device, there's obviously a full-fledged website. But now individuals who have a phone, who have a smartphone, we have a fully mobile Compass website on the phone as well now too. And so the functionalities are pretty much entirely there on the phone or laptop. We're working on some tools that will help a person know if they're uploading a document like a pay stub, that we're going to be able to clearly read that document when we receive it. Some of you may be familiar if you've ever deposited a check through your bank. It will tell you if the image is good or not, and sometimes it actually makes you retake the image. So we're going to be applying a similar technology, because that's a place where we find sometimes those things are blurry and our staff can't read them, right? So then that necessitates having to go back. And so it's things like that where we're trying to identify the things that are barriers most frequently or cause almost like logistic issues most frequently, and address them with digital solutions. So you'll be hearing more about that in the next 1 to 2 weeks. Yeah.
For those who don't report within that 3-month period and the 3-year allocation, would they be allowed to reapply at any point within that 3-year period?
Yes. So the question is, if somebody, let's say, was due to start reporting this past September, went through September, October, November, maybe they didn't hear, right? Maybe they didn't get the word. December comes and they now realize they've lost their SNAP benefit. Absolutely, they can come back. They just have to demonstrate that they met that 80-hour requirement for a prior month, and then we can get them enrolled back in. Yeah. But they'll have to continue to demonstrate, to not be at risk for a future loss. Yeah. Yeah.
Question.
Yeah.
For those who get stuck sort of in between and they need food resources immediately, is there a map or a resource for them to go find local food banks or other resources to help them with that need?
Yeah, John, great question. So the question is, if somebody does get separated from their SNAP benefits, what resources are there to help them meet any food needs? So first of all, I just want to give a shout out to our charitable food network. It's extraordinarily strong across our Commonwealth, and it is an essential part of making sure that families are not food insecure. And individuals with SNAP also make use of food pantries in our charitable food network. SNAP is supplemental. The S in SNAP is supplemental. It is not by any means somebody's full food budget. However, what is important to know is that our charitable food networks are extremely busy right now for many of the reasons that Representative Waxman cited. The cost of food right now is going up, 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 up. It's being really impacted by some of the tariffs that President Trump has imposed. And so when food's more expensive for families, it's more expensive for the charitable food networks, who are also purchasing food. So it's a difficult time for everybody. Our food pantries are already busier than they've ever been. Most of them are busier now than they were during COVID. And for every meal that the Charitable Food Network is able to donate to a family, SNAP pays for 9. 1 meal charitable, 9 meals from SNAP is how the ratio works out. So you can quickly understand that there is no scenario under which our charitable food network can make up for the loss of SNAP. So we're very mindful that the most important thing we can do in this moment is keep people who are eligible for SNAP connected to their benefits. However, we know that there will be people who can't meet these administrative barriers. And so the easiest place to go is that PA Navigate, pa-navigate.org. When you go to that website, there's a place to type in your zip code, and then there's like boxes across the top. One of them is food. And so there's food, housing, clothing, transportation. We're hoping to get volunteer opportunities up there soon. And they can just click on that. And again, because it's zip code based, they'll be able to see pantries in their zip code, or they can put in whatever zip code they want. Some people would rather go closer to work, or whatever makes sense for them. And pantries have different rules about who can use their services, and so the way PA Navigate is set up, it's all in there. So they can see if they would be able to use a particular pantry, what the address is, what the hours are. It's pretty comprehensive. And at this point, we've worked with community-based partners all across the state. Most of our community organizations are in PA Navigate now. So it's a very, very robust resource. Yeah. All right, anything else? All right, thank you, everybody. Appreciate it. Their families every day and directly invests in the grocers, the food producers, our Pennsylvania farmers. Small, clear about that. It doesn't mean that they're not eligible, but because they have to navigate a whole bunch of new red tape. In Philadelphia County alone, the Pennsylvania Department of Human Services estimates that more than 45 administer SNAP in Pennsylvania. And we're working hard right now to simplify systems to help the Pennsylvanians we serve understand and prepare for these changes. Is to help people through the transition as much as we can. So let's talk about what's happening in SNAP. Changes to SNAP are already underway and are happening for the charitable food networks, who are also purchasing food. So it's